Why is autosomal recessive important in family genetic testing? Have you ever wondered how certain genetic conditions are passed down through families? Understanding autosomal recessive inheritance can provide some answers. This pattern of inheritance is vital in family genetic testing because it helps identify who might be affected by specific genetic disorders. In autosomal recessive conditions, a person needs to inherit two copies of a mutated gene, one from each parent, to develop the disorder. If both parents are carriers, each child has a 25% chance of inheriting both mutated copies and being affected. There is also a 50% chance that the child will be a carrier like the parents, and a 25% chance of inheriting two normal genes and being unaffected. This means that the disorder can sometimes skip generations, making it appear unexpectedly in families. Identifying carriers is essential for family planning. Many people who carry a mutated gene do not show any symptoms. Knowing this information can help families assess the risk of passing on a disorder to their children. It is also important to note that both males and females are equally likely to be affected by these conditions, since the genes involved are located on autosomes, which are non-sex chromosomes. When families have a history of autosomal recessive conditions, such as cystic fibrosis or sickle cell anemia, understanding this inheritance pattern guides testing strategies. Genetic counselors and healthcare providers can accurately interpret family trees, spotting patterns like affected siblings with unaffected parents. This knowledge is especially important for families with related parents, as they may have an increased risk of passing on these conditions. Furthermore, understanding autosomal recessive inheritance informs reproductive decisions. Families can consider options like carrier screening, prenatal testing, and pre-implantation genetic diagnosis. These options can help reduce the risk of having children with genetic disorders. In summary, autosomal recessive inheritance is a key concept in family genetic testing. It explains how certain inherited conditions manifest and spread through families. Recognizing this pattern allows for early detection, risk assessment, and informed decision-making for families concerned about hereditary health.